waifu, no. I'm gonna do some of that Star Citizen stream.
Citizen. Star Citizen.
Yeah, also. Excuse me. Let the wife know.
Why don't you come teach?
Why don't I come teach?
Yeah.
I don't know.
I mean, I know it's probably.
I don't have a particular desire to be up there, to be entirely honest. I mean, yeah, you can jump calls when you're up there, because, I mean, they do it all the time, but I just... not my cup of tea.
What is jump calls?
So, if a call comes in and you're up there at the office, and you can make it there and help on scene, they will sometimes do that. They'll go to that call, even though they weren't dispatched, which would be how they would jump a call.
Huh. That's cool.
Yup.
Oh.
But I've had a couple times where Jason's jumped a call with me, and Jackson and Randall before he left. I don't think you ever met him.
Nah, he just kind of stopped by every once in a while.
Yeah, it don't make a shit.
Yeah.
Yeah, that's him. That's his voice. I had a pretty good relationship with that guy. I had no issue at all. But a bunch of other people did not enjoy him at all.
Like, yeah, apparently he was hard, but I mean, apparently he was good at his job though.
Yeah. I never had an issue, but I've known him, but I've also known most of them up there since I was a kid. Okay, guy just walking through the little garden thing they got there. That's pretty trashy. Way to go, guy. With your long sleeve short sleeve shirt combo and your sunglasses on the inside of a dark room. Exactly.
This section of testing is kind of different.
What all are you trying to do, or what all are y'all in right now?
This is medical emergencies.
Ah.
Tonight is allergic reactions, poisoning, and overdose.
I was about to hit you with something, but it'd be kind of rude if I did.
What?
I was gonna say, what's the antidote to I think it's TSA or TSS overdose. It's generally described as antidepressants.
Activated charcoal?
Maybe. That would be hopeful, but no. That was a lowball thing to do. I would have been surprised if you'd known it. That one, I believe, is sodium bicarb, if I remember correctly. Well, that was almost scary. The elevator doors opened up and there was nobody there. And I think organophosphate poisoning is fixed with atropine.
What are the words that you are using?
pesticides, stuff. Are you a Pyerson? You have lupus? Oh, there it is. It formed in.
Uppers, downers, doesn't matter to me. I take them all.
Yeah, this guy gets it. Yeah, put it on the tree. Cutlass black. Collect. Processing your request. Work order delivered. Sweet. Time to go make some money.
I think there's a chance that I open back up my hernia.
There's a chance, yeah. What makes you think you did?
A stabbing pain?
Stabbing pains? Could.
Yep.
Is it like a tearing sensation?
No, it felt like a stabbing pain right where it was. So.
It's possible.
Mm-hmm.
Very
I'm
possible.
just keeping an eyeball on it.
Probably should.
Looking for any bulges that aren't supposed to be there.
Notices your bulge.
But we were doing death by burpees.
Oh. What, Hop, have y'all doing burpees or something?
No, Troy did.
Troy.
Mm-hmm.
Who the fuck is that?
I don't know his last name.
I don't know any Troys.
The maintenance guy? He does a lot of maintenance.
Trey.
Trey! God damn it, yeah, Trey, not Troy.
What was he doing out there?
They've been doing the gym. Him and Scott have been fixing up the gym.
Yeah, but he had y'all doing burpees? Or you were working out
yeah.
with him?
No, he was, instead of running, we've been going to the gym room to do stuff. Like, I guess Chief has just been letting Trey decide what we do that day for physical activity.
Big sketch.
What?
I mean, that's not bad that they're doing something different. But, we usually ran every day.
Yeah, well, to
Are
be
they
fair,
still getting good cardio in though?
oh, to be
Okay.
fair, the workouts that we've been doing have been harder than running.
Okay.
It's been kind of,
I was
it's
saying,
been
the
hard
burpees-
enough.
The burpees alone are those are kind of rough, but
Kind of think I tore open my fucking hernia with it.
yeah, it's not impossible, especially with a burpee. It's a lot of movement right around that sensitive ass area.
Yeah, and I made it to round 14.
Yeah. So it sounds like he's just hitting y'all with CrossFit exercises.
Yeah, pretty much. I hope that's not what
Medals.
happened. But
That's cool.
today we did something a little bit easier. We did like some CrossFit bullshit where it was like stretching and then sit-ups, sit-ups, I forget what
Sit-ups
they're
and
fucking
then
called.
sit-ups and some more sit-ups.
Yeah, and push-ups and shit like that.
I got you.
And then afterwards, I felt it again, and I was like, "Uh-oh."
The tingling sensation in your nutsack.
The
Says,
fucking
Chuckles, I'm in danger.
I was like, dude, if this bullshit made me fucking open that shit back up, and I gotta go to the entire academy with a fucking hernia, I'm gonna be so sad.
Mine hernias typically don't just fuck off.
No, yeah, they don't.
Thank you, and please visit again.
It's
The only option is surgery, but I mean, I can't get surgery while I'm in the academies. I'll wait until at least
Well, not
out
with that
on the
attitude.
truck. I mean, they wouldn't let me just go get a had surgery. And then missed.
Chris Jones had a surgery.
Oh, I mean, they might. I don't know.
Talk to him.
I assumed that they wouldn't. So
Just talk to him.
it scared me.
McMillan?
No, I'm just kidding. No, he's.
I was about
really
to say
cool.
that dude's a freaking poon.
I think McMillan likes me.
He might. Are you doing good in your tests and stuff?
Mhm.
You seem like you know what you're talking about whenever you're talking about it.
Mhm.
Okay, yeah, he probably likes you.
Yeah. I would say that I'm.
I'm listening.
I'm definitely in the top 5. I might be top 3. I might be 1.
Who knows? Y'all don't compare
like-
y'all scores.
I mean, we do, but we all make about the same grades.
Ah,
Like, I might be a little worse on something, and then the next test would be better.
yeah.
Like, all of us are high 80s, low 90s, sometimes high 90s.
That's
all in
good.
that ballpark.
This is usually what I did whenever I went through mine. Stayed around mid to high 80s and sometimes in the 90s, if I remember
Yeah.
correctly. Got a little lag. Excuse me, what the fuck? There we go.
I'm gonna go grab my pizza.
Go grab your pizza.
In my penis.
Aha! This guy gets it. Oh, I am going down. It's a baby cloud layer. I think they're supposed to fix that in this next update.
Please proceed to assigned landing bay.
Welcome back.
Uncle Uncle.
Ah, there it is.
Hmm. Pop's a really good teacher. I really enjoyed him.
Oh yeah. Yeah, he helped me a good bit whenever I had to put my. I say he helped me a good bit. I mean, the little that he did was enough that I needed to figure out what the fuck I was doing wrong whenever I was trying to put on my gear, and a lot of time.
I don't remember the guy who taught us cardiac shit, but Lieutenant Davis or some shit.
Lieutenant Davis.
Yeah, I think so, something like that.
Was he kind of bald? No, that wouldn't be him.
No, he was younger.
Davis.
I don't quite remember. I know he's related to someone in my class. That's his brother-in-law.
I couldn't tell you.
Yeah, he lives in Ruston.
Landing
Anyway,
complete. Have a pleasant stay.
really nice guy. I appreciated him taking time out of his day to come to eat,
Yeah.
but not great teacher. It just
What was he teaching you? Cardiac?
cardiac emergencies.
Thank you. I mean, like, did he go into detail in anything? What?
And put it this way, I don't remember that chapter very well. I'm gonna have to go back this weekend
Oh,
and restudy it.
oh.
Yeah,
You have to think about what all y'all's
that's like
actually entail.
all the different types, cardiac emergencies and shit. Like angina.
Night pectoris.
Mm-hmm. all the
Angina
all the
pectoris. Chesticles hurt.
I don't feel
Quick.
very comfortable on that.
Quick, if a guy is having crushing chest pains, diaphoretic, and the pain is shooting down his left arm, what's going on?
Yeah.
You don't
There's a
know?
heart. There's a heart. An AMI.
Acute myocardial infarction, probably.
Mm-hmm.
There's a very good chance. Very good chance.
Was that the answer you were looking for?
Yeah.
Or is there another one?
Yeah, no,
Okay.
that's pretty much it. Quick, if a woman is having abdominal pain,
Oh fuck! Here we go. I know that's different. Fuck.
if a woman is having abdominal pain, is diaphoretic, and also having jaw pain, what is possibly going on?
An AMI.
It's possible.
Because
Sure.
sometimes, because older people and women don't present the same, right?
I don't know about the older people part. Usually it's pretty generic. It depends on the gender, mostly. Women
Okay.
typically show that way. They'll have abdominal pain when they're having cardiac issues. Which is why a lot of times when you go to a call with abdominal pains and you're with a medic that knows what they're doing, or Cadian shows up and they're following their protocol, they do a 12 lead just to make sure.
Okay.
So they're trying to look at their heart and see if there's anything going on.
Okay. So if that's happening, would their blood pressure be? Their blood pressure would be high, right?
Probably, given that they're in pain and the heart's kind of probably starting to freak out a little bit because it's lack of oxygen, so it may be trying to pump harder, trying to get around the clot. So it'll
Okay.
pressure high enough to get past
We're
it,
sorry.
if possible.
You've exceeded the allotted time to depart.
See,
You'll have to return your
I've
ships.
got to
not
go all the way
always will
back
that
to
work.
vitals too, because my vitals, I still don't understand vitals
Initiating ship storage
and like
procedure.
symptoms.
For your safety, please vacate
How
the
do you
area.
mean?
Thank you for your
Like,
cooperation.
Someone tests questions whenever they give me the vitals. I'm like, I don't know what the fucking symptoms of this are. Like, I don't know. Are they gonna have a high pulse right now or low pulse?
Initiating
Okay,
ship
give me
storage
an
procedure.
example.
For your safety,
Um,
please vacate the area.
Like, for
Thank
example,
you for your cooperation.
You don't gotta like rush into it, just you know, whatever you got.
yeah, like, let's say hypovolemic shock.
Okay.
So
Is this an
that'd be
adult or a child?
an adult,
Okay.
but either one.
True,
No,
either one, however, adults can compensate much longer than a child can. Because once a adult comes out of compensation, it'll taper off a little bit slowly as compared to a child. With a child, as soon as they start to decompensate, you are in trouble big
Dunzo.
time. Just random T-posing headless guy everywhere I go. But yeah. Anyhow, so continue, my bad.
So like, I don't know what blood pressure would be. I don't know if it'd be high or low than that.
Typically, it'll be a little lower.
And why is that?
Because there's not enough blood in there. Hypovolemic means
Okay, so
low
it'd be-
volume.
Right.
Usually originating with low blood. Especially if it's like a trauma.
Mm-hmm.
However, you can have other times where they're just ridiculously dehydrated or some shit like that, but that's going to be kind of
Like pooping.
intense. Yeah. Pooping can do that.
I think the correct term's diarrhea and vomiting, but
Defecation
god damn it.
and vomitus or emesis. Alright, made some more money. Now I need to go buy a mining head.
Like we quite literally, whenever altered mental status and stuff today, the only blood pressure that I remember is stroke is usually going to be high.
They said it's usually going to be high.
I think so. Maybe.
Typically, with a stroke, the systolic is going to be around 200, if not better. So the top number.
Yeah, so high. Right?
Yeah. Yeah, that's pretty fucking high.
Oh.
Considering the AHA, I think their norm now is, 124 or 120 over 64, 65.
No, don't do that.
That's
Don't
the
do that.
normal.
Don't give me odd numbers. Don't do that.
That's what they do.
No.
And that's thereabouts the norm.
We like nice round numbers that I can kind of remember.
Well, you're gonna have to get over that. It's flashcard time, buddy.
Now arriving from TISA Spaceport.
Now arriving
Stand
from
by
TISA
and let
Spaceport.
passengers disembark before boarding.
Like, just ask me any random, like, thing.
Okay, a dude's
then-
leg got blown off. What do you need to worry about?
Well, a hypovolemic shock, but I'm talking about, like,
That's one.
bleeding out. Right?
Bleeding out is another, which would cause the hypovolemia.
Yeah. So tourniqueting his
What
leg.
else? You said tourniqueting his leg. Yeah, that's something you need to do, but what do you need to worry about? What do you need to keep in the back of your mind? His leg got blown off.
Scene safety.
Scene safety. What about scene safety?
This is scene safe. BSI, scene safe. I got my proper PPE on.
Maybe. Maybe it's safe. If someone's leg or something like that, if you go to an explosion, if it's not,
Call law enforcement.
yeah, you need to call law enforcement, but if it's not just obvious that this guy was like holding a welding torch next to a gas can, you know, something stupid like that, or whatever, you need to be worried about possible terrorism and stuff like that, secondary explosives, and things like that, because people will detonate shit, wait for first responders to arrive, and then detonate the other part.
Yeah, you just threw it back all the way to like chapter 2.
Yep, don't forget that shit.
Damn.
There's also a gang initiation ritual that involves shooting firemen, so pay attention to your surroundings at all times.
Sicko.
Yeah. I mean, if I'm walking up to a house and there's a lot of windows at it, I start getting kind of nervous. Paulo, zip your lips.
Is it a lot of windows out?
If there's a lot of windows at it, like
Oh.
it has a lot of windows, I tend to get a little bit nervous. Because I'm
Really?
like,
I think I would
frick
get
that.
more nervous if there are less windows. Because I can't see inside.
True, however, if there's a lot of windows, it's a lot of angles. And you can't look at all of them at the same time. But there's a couple windows, you can look at those couple windows. And you can knock on a door or something like that and be like, hey, fire department, and stand off to the side and listen.
Whoa. Whoa, lean cuisine pizza.
Get out of here.
Um,
Well, that's coming in. I need to get a mining head.
Oh. but I meant, ask me the symptoms of a thing.
Of what?
I feel like I really suck at symptoms. Like,
Okay. You know what skin turgor is?
no. Skin turgor?
Okay, so turgor and stuff like that, specifically if you're talking about skin turgor, it's trying to see how hydrated that particular individual is.
Oh, the pinch thing?
Yes. So you kind of pinch up the skin. If it tense, like tense up, like a
And
tent when you're
stays
camping, then
dehydrated.
that means that they are dehydrated. Generally.
Turgor.
Turgor. Burr, burr, burr. Gur, gur, gur.
Hey.
Ham.
Your
Burger.
turgor jobs.
Your turgor, dur. He's so damn turgorty. But,
Jim skin turgor herbs.
turgor, dur.
Okay.
Anyhow. But,
we're back.
we're back. Anyways. Okay, so you show up to a house. Chief complain of sick person, altered level of consciousness. You get there, you notice a person lying on the couch, bucket beside him, and they appear diaphoretic as you walk in, like you can kind of see something.
Okay, diaphoretic means pale and sweaty, right?
Diaphoretic just means sweaty.
Oh. Okay, well, I'm gonna do my my ABCs. So,
Nemesis.
I'm gonna do my ABCs now. Mr. Man, are you breathing?
He's breathing.
You're breathing. He is unconscious, correct?
No, he's not unconscious. It's an altered level of
Oh.
consciousness. So, an
Oh,
altered level of
oh.
consciousness just means they could be talking out of their head, they could be unconscious. Or they're just
Yeah.
freaking like, what color is this? 78. Alright, that's not okay.
Yeah. Yeah, you're right, Mr. Man. I'm gonna get that glucose. Give me glucose.
You want to talk to him?
Oh no, I wasn't doing like the sheet one. I was just a quick one with you.
Just a quick one.
Yeah, just a quick one.
Okay. You checking his glucose. Glucose is 78.
78. Uh-oh, that's not... I was expecting something else, Mr. Man.
You expecting DKA?
I was expecting hypoglycemia.
That wouldn't be
And it's-
hypoglycemia, that would present that way. That'd be hyperglycemia.
Oh yeah, sweaty is hyper.
Yeah, because their body's trying to put it out. Trying to
Right.
get rid of it.
Yeah, that would be
Where the
DK.
fuck am I walking around right now? Am I going
I
crazy?
keep thinking diaphoretic means like cold and clammy and
No,
fucking.
typically that's more common with your trauma and hypovolemia. So if you're going over hypovolemia, I understand where that's getting tossed in there.
Ah, shit. I think that word may fuck me up on a bunch of tests.
Probably.
I probably that means the complete opposite of what I think that word means. Especially on this chapter, diaphoretic means fucking sweaty, which would be fucking hyper.
Yeah.
Okay. Alrighty. Alright, Mr. Man. Either
Alright.
way, your
Blood sugar is
sugar's not the
70.
problem.
What did I say? 78, 74, whatever.
Yeah,
77.
normal. Alright. Alright. Alright, you're talking all crazy, so I'm gonna go ahead and do that.
In a variety of
Is it-
fields.
What's the
Well, you
difference
ain't
between
even
the?
talked
Yeah, but he's fucking crazy.
yet. Yeah, but just looking at him, okay.
Alright, we got it. There's just one other thing that I would like to go ahead and roll out
uh-huh.
by doing either. What is the difference between a Glasgow stroke thingy and a Cincinnati stroke thingy? Or is it the same?
Those
shit?
are two different things.
Which is the one where I raise the
Glasgow
hands?
coma,
Yeah, Glasgow
GC
coma.
GCS.
Travelers at any time.
So that's just assessing their mental capability and mental status. A Cincinnati stroke test is you're legitimately testing them for a stroke, so that would be the arm raising. You're checking both sides, getting them to smile,
Yeah.
testing their
So-
speech, so you can hit them with,
Next stop, Central Station.
what is it? You can't teach an old dog new tricks. Or if you
Yeah,
really
that's
want to
the
fuck
one.
with them, you can do the Irish thing. And, remember it say, can you say around the ragged rocks go round? If you really want to fuck them up, do that.
Dude, I'm gonna sound like I have a stroke.
Yeah. That'd be a little bit much. And assess their mental status. Also, you can, probably my favorite mental status question was, she used to work with Acadia, and her husband went to Pafford, I think. I don't remember. I want to say it was Pafford, but her question that she would use is Mickey Mouse a cat or a dog?
What?
Yeah. And if they gave you cat or dog, obviously it's not right. But usually the response to that with somebody that knows what's going on is, are you okay? Like, obviously it's a mouse. Alright, cool.
Okay, so Cincinnati is the one that I think of.
Please watch your step when disembarking.
Yeah, that is the one you're talking about, though.
But what's... So what would the Glasgow one be? Just seeing, like, checking
Just-
them...
Checking their status. They follow commands. Whenever you walked in the room, did they open their eyes and look at you as soon as you walked in? Did you have to talk to them? Verbal, painful, stimuli, things like that.
Okay, and what's VAN?
Van?
Verbal-
I can't remember the acronym, but it's for stroke also.
Yeah.
There's an app you can download on your phone that you can use. That'll actually help you out a lot.
Well, anyway, I'm gonna raise this fucker's arms.
Stand
Does
by
one
and let
sloop?
passengers disembark before
Nope.
boarding.
That's gonna give me a big old smile, you fucking freak. Does one, does one fucking droop? Does it give me the fucking Scarface?
Nope.
Alrighty.
You're really overreading this.
Really?
Yeah. So you
Okay.
came in
Next stop,
and
Mason Station,
you see this dude laying on the couch, called in as a sick person, altered level of consciousness. He's a little diaphoretic, and there's a bucket beside him.
Alright.
What is?
Back,
What are
back
you
to the
thinking? Just thinking
ABCs.
about that.
Yep, he's probably vomiting, so I'm gonna check the skin.
There you go. Better.
Give me-
Okay, you check in skin. What are you doing?
Turger.
Okay, he's tenting. What else with the skin?
Okay, so if he
now arriving
was
at
dehydrated,
Station, North Quarter.
You want to check for
Watch your step when disembarking.
maybe a fever?
so he'd be having a fever if he was dehydrated.
Attempting to trespass on train tracks is a serious
He'd be having a fever if he's sick, which caused him to
Oh.
get dehydrated.
Oh. Hey, this is why you're better at this.
This is a simple one,
Oh.
but you're over examining it, if that makes
I
sense.
see. I see.
Did I just show up in the wrong damn spot? Possible.
Okay, sir. This is why you go down the sheet instead of the fucking quick one, huh? Because
Yeah.
if I would have just went down the sheet, I probably would have already figured it out.
Yeah, that's okay. This is also a difference in somebody that's done this for 6 years and somebody that's
Yeah.
just starting class. So,
Okay, so boy is sick, boy is dehydrated.
yep.
What could cause this?
Well, there's a
Well,
number of things that
I'm-
could cause it. Are
I'm gonna
there-
go ahead and
or there-
auscultate the lungs. Do I hear any weird fucking noises?
You hear some crackles and wheezing.
Some crack and wheezing, huh?
Yep.
Alrighty. Mr. Man's lungs are fuck you. Alrighty. Before he dies, I should probably go ahead and check his O2 and respirations.
Yeah, you should probably get his baseline vitals. That would be
Yeah,
a
I think
good
I think
idea.
that's a good time to do that before he dies.
O2 is 93.
93, not too bad, my boy.
What else?
But we are gonna go ahead and throw you on the nasal cannula.
Do you want to do that, or do you want to find out anything else about the guy?
I would go ahead and do that. I
Okay.
would like to go ahead and do that.
All right.
Welcome to Metro.
What else do you want besides
And industry line.
O2?
Let's go ahead and get a pulse. Just go ahead and get my baseline vitals. You're right.
Pulse
We can
is
do this.
98.
Pulse
Blood
is
pressure.
98.
No, let me run that back. Pulse is 105.
To your fellow traveler.
Blood pressure is 98/64.
Next stop.
So now I'm kind of fucking with you a bit.
It's a little low, huh?
I've added some shit to it as I'm going
Let's
through it.
do it.
Like
Go ahead.
since
Die
you
for.
since you did say before he dies, and I was like, well, this is gonna make him a sick guy, but if you insist.
No. See, I live with my mistakes. Because that's what I would have worked on. Well, then again, I would do this completely different if I was testing.
Yeah,
This is kind of me seeing where I can
Relaxed.
get just spitballing.
yeah.
Yeah.
Well,
Now
keep
arriving.
going.
Keep us safe.
Okay.
Please watch your step when disembarking the train.
So with the air,
With the air.
Trespassing or
okay.
train shock is a
Does
serious
O2
and
go up?
dangerous offense.
Yeah, it increases to about 95.
Okay.
Would
Good
you,
enough. We'll believe it.
actually, did you even tell me a liter per minute?
I didn't, but it would be.
So then it'd still be at 93.
6. No. Okay. 6.
6?
I will take 6, please.
You're gonna blow boogers out of his nose, alright? So sorry, bro.
What?
Got a blast! Alright, so it's about 97. If you're gonna put it on 6. Hello?
I'm sorry, I'm fucking dying laughing.
Oh, they got a
Oh.
blast.
Dude, could you not? I laughed so fucking loud.
It cut out.
Oh my, I probably peaked my mic, honestly. Anyway, yeah, as soon as you said, oh shit, dude, I gotta pee. Okay, anytime someone does that from now on, I am saying that for sure.
I got a blast.
Okay.
Jeez.
Anyway, God, I'm hot now.
You're welcome.
All right, how would you choose what leader to? I know it's 2 to 6, but how would
Typically, I'd start low,
start low? Then what's it
then
called?
go
It starts
up.
with a T.
Titrate.
Titrate. That's the
Titrate
word.
to effect
I
would be
fucking
the
hate all
whole
these
thing.
stupid fucking medical words that I don't need to fucking know. Just say change.
Don't
Just
feel-
say change.
Don't feel bad because until I was in medic school, I had never heard titrate.
Me neither. Fuck that word. Just say change.
Yeah. You can't do that. You gotta be fancy.
It's so fucking privileged white male.
What?
Anyway.
Literally anybody in the medical field uses that.
Privileged white male.
Okay, I'll just go tell the black doctor that I met in Conway that spoke Mandarin that you said that.
Privileged.
Said, sorry, guy, you're white now.
Yep, let him know.
Welcome, I guess. Why can I not get in my seat? Star
Okay.
Citizen, are you shit in the bed?
Alright, so anyway, I live with my mistakes. Booger's blowing out this guy's nose.
Okay, got a blast. There it is.
Alright.
Okay, you're blowing boogers out of the guy's nose. You do want it on 6.
Like, for future, I know start low, but,
You're gonna
like,
keep it there.
yeah, like I've already said, I want to live with my mistakes on this one.
Okay,
If I kill this guy, I just kill this guy.
okay. Well, you've been on scene forever.
Well, yeah, but we're doing this.
So
He's
do
not
you want me to
dying
go
good
ahead
at time.
and- You want me to go ahead and get the, well, he might.
You are clear to
Let me go ahead and get the
No.
ambulance in. Because they should be here by now.
Yeah.
Huh?
Yeah.
Yeah? Okay.
Yeah, but we're going pneumonia, right?
Huh?
Pneumonia, crack. Oh, wait.
Not necessarily.
Oh, I changed my mind.
No, you're living with your mistakes, remember?
God damn it. You know what? Alright, I remember the nasal cannula. We're going CPAP, baby. It's pneumonia.
Oh, God. CPAP would probably help them a little bit.
Please visit again.
So, don't forget to ask questions. That's the biggest thing.
Yeah, no,
Especially when you're in a patient's house, don't forget to ask questions. Because, let's say something that would have been a big help is,
his
what is
medicines.
this patient's medical history? What is this patient's medicines?
Yeah.
If there's family there, which there was, and they just sat there and looked at you while you talked to yourself. They were like, I guess this guy doesn't want my help. I'll just go fuck myself. And if you'd asked, you'd have found out that they had COPD in your crackles, and he hasn't had his albuterol treatment yet. It's got a little wheezing going on.
Yeah,
got some
see-
shit in his bronchioles.
That's where I was like,
And
that's where.
if you would have also checked the condition of his skin past turgor, so he's diaphoretic, okay. Typically the body sweats to either get rid of or reduce temperature. Okay. So
Uh-huh.
you might be running a fever. So
Right.
that'll lead you to that. Another thing which they may or may not have hit on yet is
Wait, hold on. Does
Go ahead.
COPD cause?
No.
Okay.
none of that stuff.
So why did?
I'm getting to it. So this guy might have been having some kind of sickness that's causing him to have a fever. Okay,
Okay.
so check temperature. Feel their forehead with the back of your hand, stuff like that. There's also
Holy
on the trucks
shit.
now we have thermometers. But it's the laser ones, they're not super accurate. They're usually a couple degrees off.
Now
But
that
we
you
have
said
those.
that,
Makes a lot of sense now.
yeah. Now that you say that, Like in my actual one, I do check circulation like with the back of my hand as I'm doing the rapid gross
You
blood
check
sweep.
circulation with the back of your hand?
No, on my ABCs, like during my primary assessment.
You check
As a-
circulation while you're checking pulse? Maybe.
Yeah. So do you remember the sheet that you go down?
Yeah.
Yeah. While I'm doing the gross blood sweep, like examining for any blood during the C part, I just go ahead and check temperature.
Yeah, that's a good thing to do.
Get all my ABCs out the way and every vital that I could possibly need.
Yeah, so that's part of what you needed to know.
Now I see why it's structured.
Yeah, but another thing is, so if you would have found out that he had a temperature, you could have tried to find out why it was causing that, so you could have done your head-to-toe assessment, things like that. You may have found a large wound on his leg that was kind of dark around the edges and pussy in the middle, and it looked like it had some red streaks, indicating that it's infected. Now, what I was meaning earlier by they may not have hit on this yet is septic shock. So typically with septic shock, you'll have a higher heart rate and lower blood pressure, or excuse me, scratch that, reverse it. Usually I think the heart rate's a little bit lower and the blood pressure's a little bit higher, because it's kind of like neurogenic shock. If I remember correctly, I'm fucking myself up now, but either way. So that can be part of it. Now, also with sepsis is it will cause altered level of consciousness, stuff like that, to happen.
Oh.
And it can kill them quickly if it's left untreated. You have to have aggressive antibiotics.
Yeah, but hey, if that guy was having a stroke, I was getting there in that 1 hour for sure.
Yeah, that's for sure. But he's not having a stroke.
Yeah, but like, if he was, think about how quick that would have been.
Jesus Christ. Okay, do you want another one?
Yeah, I'll do it actually properly this time.
Okay, this one will be. This one should be pretty easy. All right. Respond to a breathing problems call. Arrive on scene. Guy sitting in his house alone, since we don't like to ask questions. Sitting in his house alone.
I'll do my OPQRST AMPLE this time.
Either way. But he's still sitting in his house alone. Sitting on the couch in tripod position. You hear wheezing as soon as you walk in the door. Go.
Wheezing as soon as I walk through the door.
Wheezing.
BSI, scene safe.
Scene safe.
Alright, I got my proper PPE on,
Yeah.
which would be gloves and
Breathing problems. Think.
I know it's a face mask, but is it the surgical or no? It's the 95.
You can. Typically, I wouldn't give a flying fuck either way, but
Me neither, but
that's
you know.
just me. I'm not. This ain't a test. I mean, it is, but it isn't.
Yeah, now we're testing though.
Yeah.
So
yeah.
N95 and goggles.
Or you
All
can
right,
just
yeah.
wear the protective safety glasses. You do you, boo
Yeah.
boo.
Yeah, that one. Anyway, my face is covered. We're good. We got the proper.
Yeah, we got the
All right.
stuff.
Is this my only patient?
As your only patient.
Only patient. All right. See, he is sitting in the tripod position, so no need to immobilize the spine. All right. The
It's a
what?
breathing problems call. Why would you immobilize the spine?
No, I said he's sitting in the tripod position, so there's no need to immobilize the spawn.
Yeah.
On there it says you gotta consider the C-spawn immobilization. So I gotta say it out loud.
You don't have to if it's not a trauma call. I never did whenever it wasn't a trauma call.
Listen
Never
here, I'm
even
trying to
said
get
it.
I'm trying to get my point, okay?
Okay, well, get your point.
The nature of illness is a breathing issue, a respiratory issue. All right, I'm gonna go ahead and request an ALS ambulance.
Okay.
Then
One's
we'll
on
move
the
on
way.
to my
The guy's
primary
still
assessment?
wheezing on the couch.
I have 15 minutes, sir. I need you to chill.
Okay, well, you tell that to the guy that can't breathe.
I will.
I would cry if we ever worked together and you said some shit like that. Oh, God.
Sir, I'm trying to get all my points here. Can you stop wheezing?
Can you fucking, like, shut your mouth for 2 seconds, guy? Thanks. Jeez, the nerve.
My general impression is apparently this guy's wheezing. He's in bad shape. Okay,
Okay, well, is he in
Um,
bad shape?
he is wheezing.
He's wheezing.
That's all I gotta say for my general impression.
Okay. So
Um,
your primary impression is he's wheezing.
I am going to go ahead and make him the priority patient.
Yeah, he is the only one there.
Yeah, well, I'm trying to get my point.
Trying to get your point across.
Is there anything else that I need to do before I talk to this fucker?
I don't know, maybe fucking go talk
Nope.
to him.
No, that's everything. All right, cracks and knuckles. Here we go. Hi, sir. I'm Nick from Washita Parish. Is it alright if I help you today? Alrighty. I'm gonna give him an A for alert at least.
Yeah. He's been staring at you the whole time while you've been talking to yourself.
I'm talking to the proctor. Okay.
Okay.
You are the proctor and patient in this scenario.
Okay, on both of them.
So, what'd you call us for today? Alright, now I get the chief complaint out of that. We're gonna go ahead and assess that airway.
That's a good idea.
Yeah, I'm gonna auscultate the lungs. What is my respiration rate?
About 12.
12. And my O2 stat?
O2 sat is 86.
86, alright, we're gonna go ahead and slap a non
declining.
Yeah, well, let me fucking intervene, goddammit! I'm gonna go ahead and throw a non-rebreather on this guy, on this fellow.
Okay.
Okay. Does this help the patient's O2 stat?
O2 sat is 87 now.
87. Alright, would have really liked to see that increase more. So obviously we will have to come back to this. Right. Are there any bystanders?
No.
Oh wait, no, you said no.
He's
Yep.
by himself. He is wheezing his ass off.
God damn it. Hold up. Alright.
He is wheezing.
I understand that this is probably gonna be fucking asthma, okay?
So what should you do? He's
I
alert.
gotta do everything else though.
No, you don't.
You're telling me if I pretty much already know what's gonna happen, I can just. I'm a fucking slap.
Okay, so this is how you would approach this. This is how I would approach this, even if I was taking this test. Okay,
Okay.
you ready?
Fair.
Alright. If you arrive on scene with breathing problems, call. You walk in the door, the guy is in tripod position. He is audibly wheezing as soon as you walk in the door. He is the only one there. BSI, scene safe, scene safe. I approach my patient. Hey man, what's going on today? At that point, if you address him early enough, you can be like, I'm having a real hard time breathing. I'm like, okay, I want to go ahead and put him on the monitor. I want to go ahead and get my vitals. What kind of medical history do you have? Do you have asthma? And he goes, yes, I have asthma. I'm like, okay, do you take any medication for that asthma? Have you taken anything today? He goes, I have albuterol, but I haven't taken it today. I said, okay. Do you know where it is? Yes, it's over there. You go find it. Since you're a basic, you can't just slap it on them. I think. I don't remember if they've changed that protocol again or not.
Well, you have to have all the vitals, I think, but I'm
Okay.
not positive.
Well, remember earlier when I said I'm going to go ahead and put him on the monitor?
Yeah.
Yeah. So you go ahead and do that when you're assessing your patient. It speeds up a whole lot of stuff, and you can go ahead and treat your patient quicker. So, anyhow, so I got him on the monitor. I found his medication. My partner's with me. My partner can tell me what his vitals are. Son of a bitch, dude. I'm just trying to freaking zip zap zop on about this bitch. Playing a game at the same time. Anyways, so I found his albuterol. I come back. He's at 86 and he's breathing through pursed lips. At this point, he's wheezing, is having a bad fucking time. I notice his O2 sat's at 86. He is unable to get it out. He can get it in, but he cannot get it out. So I'm going to assist him with his medication, his albuterol. But before I do that, are you such and such? Right dose, right route, right time, right medication. Are you allergic to any medications? No. Okay. Help him administer. You should quickly see a resolve in the patient's symptoms, given that that's how albuterol and all like that typically works. It works pretty quickly, usually. But, and then by this point, the patient should be able to talk more clearly. You can ask easier questions, further assess. You need to still get that ALS ambulance en route because it's a freaking breathing problem's call. It's just the way it is. Per protocol. And you do have to administer drugs. Drugs are going to have to be administered. And they also have things like ipratropium and things like that they can help give, and Solumedrol. So.
Yeah, but in this, I was just
But that's what I'm getting with
basically-
that. Like, you can rip through that station in a few seconds.
It's just like in this scenario,
Yes.
I was just gonna get all the vitals
Okay.
and then get to my history taking. Like instead of saying my partner gets all the vitals, I think
you don't have to
supposed
say that
practice.
you don't have to say your partner gets all the vitals. I had said I'm gonna put him on the monitor and go ahead and turn it on. And while it's taking his vitals, I'm gonna ask him some questions. Because it's gonna take a little bit to say if it's doing blood pressure. It's gonna take a minute for it to get your blood pressure.
Yeah.
So you have enough time to ask a few questions. So you do that, ask your questions, find out what you need to know. Okay, what does my monitor tell me? It's this. Okay, what does my patient look like? He looks like this. Okay. Because you treat your patient, not your monitor. You treat your patient, not your
Right.
monitor. You treat your patient, not your monitor. Drill that in your
Right.
head, because some people, I don't think you'll be that way, but some people are pretty freaking bad about it.
Like as soon as you
But,
said wheezing in tripod, I assumed that it was an asthma attack. It's just
Mhm. Yeah, you
right
just-
now I'm trying like maybe I don't understand the thing, but
What do you mean? You don't
Uh,
understand what you can actually get away with?
yeah, like so we have to make a 40 out of 42, and the way we've been practicing is we're going through each step and making sure that we're getting like the point for each thing before we actually even like talk to the person.
That sounds really shitty.
Mm-hmm. I mean, that's all.
Like, I'm not saying that
Jesus.
y'all are that way. I'm just saying, like, that sounds like a really shitty way of going about it.
I mean, basically, it's almost been like a one-man thing. Like usually, the partner hasn't
the
been
only
doing
one?
anything.
Okay.
Yeah.
Well, you might come across people like that too. But with that, I'd be like, all right. Still, you can get your vitals and everything the same way I said. Just maybe not walk away, find the medicine, come back. Typically, I don't think they're gonna just smack you with the, oh, my medication's at my friend's house. We're like, oh, great. Of course
Yeah.
it is. Do you have a backup pair or backup medication? But
But yeah, so after I had done my ABCs and gotten through that and moved on to the history taking, that would have confirmed that it was asthma. And then my question would have been, yeah, do you take any
Right.
medication for it?
right. I got you. Yeah, no, the only thing I'm dropping is like you can stack this stuff. If that makes any sense.
Yeah, like we're all sort of robotic with it right now.
Yeah. I mean, I get that. That's the way you're being shown how to do it. I'm not fussing at you at all.
No, I understand. What I'm trying to say is I would like to do it your way, but I don't know how to even practice that way.
I got you. Well,
Because,
bring your narrow ass on out to the station, and I'll show you how to do it.
yeah, and it's like, if I did that though, I don't know what I'd miss points on.
Well, you have the sheet, don't you?
Yeah.
Okay. So. Oh, goodness. Hit
Because
me
a
with a
lot of
scenario.
the shit you could do without even fucking
Mhm.
saying out loud, and shit, half of it you would do without saying out loud. Like, look, you would just look around and be like, okay, this seems fucking safe.
Yeah. You can do that, or sometimes you gotta go be assassin safe, and it's like, no, there's a dog with a samurai sword on his back, and he's shooting children. And be like, okay, yeah, it's probably not a good thing.
Yeah. But in real life, you know, walking around yelling BS I seen safe.
Yeah. That would actually be pretty great.
That would be pretty funny.
That was it.
And also the history taking is something that I'm kind of shabby on because I would have went all the way through OPQRST
Mm.
or even getting to the AMPLE, even though I know the questions I'm looking for are in the AMPLE.
Yeah. Oh.
That's something I got to get better at is getting off of saying OPQRST in a straight line. Thing is, I don't want to miss something if I jump around and then not come back and fucking miss it.
Yeah. No, I understand.
But also, what if the scenario ends before I ask that? What if I figure it out and I don't need that question?
What do you mean?
Like, for example, the asthma attack, the, like last oral intake, for example, wouldn't need to really fucking ask that.
Not typically, but I mean, you probably could. Let me hop up real quick and go bring my lady some water.
Okie dokie.
Quantum travel complete.
Okay. You still there?
Black.
Welcome back. Alright, let's pull up that Daymar. Yeah, Daymar. It's got a lot of minerals on it. But, yeah, I have no issue helping out whomever needs some help with that crap. That's,
Oh, thank you, sir.
that sounds a bit fucky.
What, the way we're doing it?
Kinda. Which, I mean, we did kinda sorta get it that way. But we took a sheet of paper and then excuse me. Took a sheet of paper, wrote down OPQRST and sample and everything else on that sheet as we assessed the patient, and we wrote everything down. I don't know how y'all are doing it exactly, but that's the way we did it, and we solved it just more or less the way that I was telling you how we solved it.
Yeah, some people.
And we would be more aggressive with, you know, certain treatments like asthma or allergic reaction, just because we know that somebody can get seriously hurt or die from that, especially even trauma. Because trauma is load and go. You better get your ass moving. You got 10 minutes.
Quantum travel complete.
That's
Yeah.
how long the station is anyway. IRL, you have about 3 minutes on a massive arterial bleed. If you get there as it starts. And that's, you have 3 minutes before they're dead.
Okay. Well, hit me with another one, and let's see if I can do it your way.
Okay. Blum 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 blum. I'm
See
trying
if
to
I
think
can
of
jump straight to the questions that I think would help the most.
I got you. I'm trying to think of a good one.
Be a fairly easy one, cause
I mean, not like something that's gonna bust your balls. And what I mean by a good one, I mean like something I can give you that you should be able to figure out pretty easy.
Cause this one's gonna be me doing it a different way than what I'm.
Yeah.
Mining mode on. Extraction mode on. Fracturing mode on.
And I'm gonna skip the shit that I don't need.
Alright, let me get close to this here piece of rock.
Landing gear down.
So we can land real quick.
Mining mode
Okay.
off.
Let's see. You arrive on scene of an unknown medical.
Unknown medical.
You hear dogs barking in the background. You approach the house. As you knock at the door, you hear loud dogs barking.
Alright, I don't know how to ask this,
Or
but
dogs barking loudly.
yeah. Hey, is that dog put up?
Okay. So you hear somebody say, "In just a minute, let me get him."
Alright.
So patient gets up, or somebody gets up, goes and gets the dog, and puts it up.
Alright, BSI, scene safe.
Scene safe.
Alright, PPE.
Okay.
My name's Nick from Washita Parish. What'd you call us for today?
Well, it's my cousin. He's back there in the back. He seems he might be feeling kind of bad. I don't know. I hadn't been able to get him up this morning, so I called y'all to see if y'all could check him out and see what's going on.
Alright, and what was the last time you saw him? Alright.
Last night before we went to bed. So
Last night.
also,
you did
so
fine?
this is about 6:30 in the morning.
Okay. Alright, and what do you mean you tried waking him up and he just wouldn't wake up?
He just kind of groaned.
He's groaned? Alright,
Yeah.
I'm gonna go check him out.
Okay.
Alright, so go back there. This is my only patient.
That's your only patient.
Alright. Alright, I'm gonna go ahead and request ALS. I can turn them around if I don't need them.
Okay.
Alright. Hi, sir. I'm Nick from Washita Parish. Is it alright if I help you? Alright. He's verbally aware. So, I'm gonna go ahead and listen to his airway. Do I hear any weird noises?
Nope. It's clear. All fields.
Clear all fields. Alright, I'm gonna go ahead and ask my partner to get the vitals. What's his respiration rate?
Respiration rate of 13.
13. Alright, is O2 stat?
O2 sat is 98.
Okay. His blood pressure?
Blood pressure is 110/63.
110/63. Pulse?
Pulse is 68.
Ooh. Okay. Alright, and does the skin, whenever I look at the skin, do I see anything?
Skin appears pale.
Pale? Alright, what's his temperature like? Cold?
Feels kind of cool.
Alright, his glucose?
Glucose is 12.
Ooh, okie dokie. So,
Well,
We'll go back to-
on your monitor it would read low.
yeah. Alright, I'm gonna go back to the cousin. Hey, is this guy, does he have any medical issues?
Well, last week he went to the doctor for his, he had something going on with his heart, and he went to his Dallas appointment after that, and, I think he has diabetes.
Alright, well,
He
yeah,
might
it'd
have
be
some
with,
sugar problems.
Gotcha, he's got that sugar. I got you.
Mhm.
He's
Oh, and he's got high blood pressure.
got high blood pressure. Good. Well, right now he doesn't, sir. Alright, when was the last time you saw him eat anything?
Last night when we ate
Last
supper.
night? Alright,
Landing gear up.
does he take any medications?
Mining mode off.
He takes
I don't know what the medic.
albuterol. He takes nitro.
So he's got asthma too?
Yes. Hold on, my wife's calling me.
Sir, this is important. Your cousin is dying.
She wanted me to hit you with the old HIV.
Okay, I can't do that one.
Anyhow, so yeah, he
Anyhow,
totally has
your
asthma.
cousin's dying, so yeah, that's great.
He's had a
thanks-
case of asthma before.
Gotcha. Alright, I don't think that's affecting him right now. So, by the way, I don't know what medicines diabetic people take, but
Metformin is one. Metformin, though, is, I believe, for high blood sugar, if I remember correctly.
Gotcha. Alright, so, alright, so I'm gonna go back to the patient. So, is this guy gonna be able to swallow? He seems very, not cohesive.
Ask him some questions.
Okay, hey, sir, you know, I said my name earlier and you just kind of went blah, I'm not sure what I'm looking for in these questions, but, because I think I'm gonna get the same thing here,
So, a good question to ask. Hey man, can you open your mouth for me?
okay, hey man, can you open your mouth for me?
Alright, he opens his mouth and sticks out his tongue.
Gotcha, alright, so
And
he's,
closes it back.
and then
So,
closes it back.
another thing to ask would be, can you swallow?
And see if he shakes his head.
See if he shakes his head or if he swallows.
Okay.
There is a
alright.
secret other option that you could go, but he's not gonna like it.
Oh, what is it?
It's the booty hole route.
Oh, I don't think. Can we do that?
Yeah, you can. It's a sub over
Alrighty.
It's a sub over later, bro.
At this point, it doesn't really matter what this guy does, because I know what route I'm taking. Alright. I'm gonna go ahead and crack my knuckles on this guy. Alright, sir, we're gonna unbuckle your pants.
Just said, fuck it, I'm not gonna see if you can swallow. Let's put it straight in the butthole. I like your style. Oh, God.
This is gonna cut my time down a lot.
Alright.
Alright.
So his pants are undone.
Alright. Here comes the rectal glucose, my boy.
Okay. Alright.
Alright.
So you took the cap off, you checked the date, made sure he wasn't allergic to
yeah.
anything, including
My
glucose.
5 hours. Wait, hold up. Wait. How would I check if he's allergic to anything?
Well, his fucking
from
cousin
his
standing right there.
cousin? Yeah, but his cousin wouldn't know if he's fucking.
He might.
I can't tell you if my brother's allergic to shit.
That's not good.
Okay, hey, is he allergic to glucose?
No, he's not. He's allergic to penicillin.
Alright, God, why is everyone fucking allergic to penicillin? What is that?
It's the shit that comes off of rotten oranges. It's found in that.
What?
Yeah, it's where you found penicillin.
I
Naturally.
swear to God, I didn't know that, but I swear to God, every time I hear like allergic reaction, it's always penicillin. Anyway,
Sure,
alright,
you
so
have an
I'm
allergic reaction to penicillin.
so I do my 5 R's. This is his.
Mm-hmm.
I will booty blast this guy with some sugar.
You should be able to give sugar without having to worry about if it's theirs or not, because that's a basic
Yeah.
skill.
Yeah, no, you're right. Yeah. Alright, so I'm gonna reassess. Is he coming back?
After about 30 seconds, the guy kind of starts looking around and he sees you lock eyes with the guy. And
Hiya,
he-
Buckaroo. How you
and he-
feeling?
And he has a little smile on his face now.
All right, sir. That'll be $20.
But that is another route you can go if worst case scenario.
Yeah. Worst case. Right.
I don't know about you, but I'm not trying to stick something in somebody's ass. Because generally, the people that have this issue, they are not people you want to go anywhere near their gastric system.
Gotcha. Alrighty. Alright, so I'm asking, hey, so how you feeling? You feeling violated?
Yeah, a little bit.
A little sticky?
A little sticky. My butthole kind of hurts. What happened?
Your blood sugar got low, man. You got diabetes?
Yeah, I got it pretty bad, actually.
Alright, when was the last time you took your insulin?
Before I went to bed last night.
Before you went to bed? Alright, when was the last time you checked the date on it?
What do you mean? I just got it.
You just got it? Okay. I'm just making sure it's not expired.
Well, evidently, it's not fucking expired if it's working. This
Wait.
guy, what a guy.
Wait,
Insulin lowers blood sugar.
Oh, I thought
Remember,
too much,
your
man.
pancreas is the thing that produces insulin.
Gotcha. So, oh, okay. So, why did this guy's? He just didn't eat enough sugar.
Maybe he took too much insulin. He may not have eaten enough.
Gotcha. Anyway, so something you did something fucky, sir. Your sugar got low. You blacked out.
Mm-hmm. Okay.
So how you feeling now?
I feel a little bit better. Feel kind of woozy.
A little
Buttholes
woozy.
just feel kind of weird.
All right. Well, I'm gonna go ahead and give you some
So you
food.
still,
That
like-
way.
So you still got your hand in this dude's ass or what?
Yeah. Well, I thought it was self-explanatory that I would have pulled that away,
Oh,
but
you're gonna pull out, huh? Don't you pull that on me, boy?
I'm gonna give him a little smooch before I do to let him know I'm a gentleman.
Gotta have class.
Yeah, gotta keep integrity.
Jigger.
Give him a little smooch.
Golly. Alright, so anyhow.
I'm gonna give you a little food and some crackers, bread.
Okay. Crackers and
Yeah, some-
bread.
That's
Nothing else. Don't want no sugar in there. Don't want no protein.
I don't know. What do you?
So
what
to
is
kind of
this?
help with that is sugar will help get it up. Protein will help it stay there.
What about carbohydrates?
Carbs, kind of the same thing with sugar. It's complex. It'll take a little bit longer to break down though.
Okay, so maybe like a ham sandwich.
Do what?
Maybe like a ham sandwich.
Pancreas can also begin to work, but we're not trying to mess them up right now.
Hold on just a second. My girlfriend's calling.
I know. I'm just saying that the other stuff was possibilities. I didn't say just because he took his insulin that he was fucking stupid. Ma'am. Bring it. I'll drop you. I'll scissor kick you in the mouth. Boy, you turds about to get smacked in the mouth.
I'm back. I'm sorry.
Okay.
What were you saying? So how would a ham sandwich do?
Okay, ham sandwich would be okay, but still need to get some
Okay.
sugar in there, just in general. Some juice
what
or something
would
like
be
that
like
with
the-
it.
The ideal food.
I mean, just general food. If you want to spike it real quick, PB&J or peanut butter crackers would be really good.
Peanut butter crackers.
Yeah.
Okay. A PB&J. I could totally make a PB&J. I'm just looking for a basic food that I could give every single person.
Or if you want to get all the mouth-breathing cousin out, you can be like, hey, can you go make me a couple peanut butter and jelly sandwiches real quick?
That dude that didn't tell me about the asthma. I got you.
Yeah.
Hey, buddy, you know how to work a butter knife?
And a couple slices, and you go put something on them.
Gotcha. Or my partner that hasn't said shit this entire time.
Outside smoking a cigarette. You doing a good
Yeah.
job.
Hey, buddy, did you enjoy the show?
Yeah.
Anyway,
Comes back
uh,
in. Partner walks back in that instant with a boner. Just like, oh. It's that kind of
Alright.
show, is it?
yeah. So mouth breathing cousin gets the. Fuck my partner. My partner's making the sandwich, and
Okay.
he brings it here.
Okay.
All right. Feed this dude the sandwich. Make sure he's locked in. Not just the glucose I gave him. Make sure he's got some long-lasting food.
Yeah.
I told him everything that happened.
Okay.
I mean, you blacked out. Do you feel pain anywhere else?
No, just my butthole.
And just your butthole? Alright. Well, that's good enough for me. You want to go to the hospital?
No, I think I'll be alright.
No, you'll be alright. Alright, well, I'm going to need you to sign this refusal.
What I
You
gotta sign
good?
that for?
Because you're not coming with us. It's kind of
You don't
means
know
you're
that.
refusing. I mean, you came earlier. I mean, you can come again if you want, but if you don't want to, you're gonna have to sign this.
Alright, I guess I'll hold off.
Alright. Thank you, baby girl. Alright. Got my refusal.
It's a nice baby bump you got there. My wife was over here rubbing her stomach at me. But,
Oh
yep,
shit.
got you a refusal.
Whoa, shit. Before I did that, I should have retook his vitals after I fucking administered that.
Yeah, but, I mean, shit, I get it. But yes, it is
Sure.
good practice to get vitals before and
Yeah.
after giving any medication.
Right. Alright. That one feel a little more natural?
Yeah.
Well, besides,
The butthole?
you know. Yeah. I always wondered, what would you do if they can't,
Butthole.
I didn't know that.
Yep, it's a sublingual layer. That's why butt chugging kills people. It's a sublingual
Dude.
layer.
Dude, this is a game changer, dude.
Oh yeah. Yeah, hit him
A
with
game
the whole shove it up the ass, see what they say to you after you tell them that.
Oh, yeah. No, this is a game changer, dude. We've done scenarios where the diabetic person isn't able to swallow and it's just transport.
Yeah.
Oh no, we're throwing a wrench in that system, baby. Tomorrow someone is getting fucking pegged.
Oh my god.
I fucking dare them to give me that.
Oh, that's too good. So, I've threatened a couple people with it. Like, hey, if we have to come back out here again, it's going in your butt. Sorry. Sorry, not sorry.
Hey man, that's just easier.
So, I mean, it's either that or, you know, you die. What you want.
So, how was that one? More natural?
Yeah, that was better.
We'll take that.
Another deal is just relax when you go through it. Which I know that's kind of I know that's kind of I know it's asking a lot, but it's just kind of the way it is. Hey, buddy. Hey, thank you for coming and visiting me. I love you too, Bubba. Yeah, I do. Sweet little boy. I don't know if you've ever heard of it, but stuff for your dog, like a supplement. It's called Dinovite.
Dinobite?
Dinovite with a V.
I have not. Dino Nuggies I've heard of.
Dino Nuggies, that's where it's at.
That was fun. I enjoyed doing that scenario way more than the way we do it.
Yeah. Ooh, 100% diamond alloy? Hell the fuck yes.
And I got to make $20 out of it.
And I made a guy juice.
Come here, sir. I'm going to milk your prostate.
What was that? What movie was that?
I have no
Guy
idea.
goes in there, it's like a sperm bank, and it's like an attractive nurse. And he's thinking she's gonna jack him off, and she shoves her fingers up his ass. Because the male's G-spot is up his ass or something like that. Or it's like, now I'm gonna milk your prostate. And all that happens is her finger blasting his asshole, and then him over there like loving every minute of it.
Hell yeah.
He's like, "Ah!" Loving every minute of it. Let's see. I'll see what my wife sent me here in just a second.
See, you see, I at least know the knowledge. I'm just having to do this a certain way.
Yeah, that's usually the problem.
What, that this certain way sucks ass? And it's nothing like I'll do outside?
Yeah, exactly.
Fracturing mode.
It's fucking dumb. Because I'd much rather cut the bullshit I don't need.
Yeah.
Now, I do understand why it goes in a certain order. That makes sense.
Yeah. Yeah.
Because the one I tried doing earlier, I was like, oh.
I don't know. Is he having a stroke? No. He has an infection. He's been throwing up.
Yeah, but that golden hour would have got hit, though.
Depends on your ambulance crew.
Power critical. Warning. Power critical.
That's true. We had some people from Acadia up there today doing practicals with us.
Yeah.
Yikes.
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 Who was it?
I mean, it's people going through their program right now.
Oh, their basic stuff.
Yeah, since Chief is teaching both the classes right now, he invited them to come do practicals with us, and
Got to see
they're
that shit show.
They're bad.
Yeah, they're typically, for whatever reason, people that are just getting their basic just to ride the ambulance. Whenever they're going through school, it's terrible. I don't know why. But that's how it's always been for me.
Like, their best person is like worse than our worst person,
Yeah, it'd be that way.
Fracturing mode on.
and they're like hella out of shape.
Yeah.
What are you doing? One guy had his shirt
What are you doing with your
untucked,
life?
and his shirt was like all the way down to his fucking quads. I'm like, tuck your fucking shirt in if it's gonna be that long, dude. Like,
How dare you?
no.
Light mode
Anyway, you're
on.
fucking.
Gear down.
Throw me another one. Scenarios are fun. I love doing scenarios.
Ugh, gross. Alright. You arrive on scene to a hit and run MVA. Auto pedestrian. You see a guy lying in the roadway, not moving. Cars are stopped on both sides. PD has the scene secure.
Alright, scene secure. I'm gonna get my PPE on. Scene save? Or, yeah, he's save.
I'll
It's
actually,
the only patient.
yeah, I'll hit you with one that I actually had one time. Yeah, it's the only patient.
Alright, I'm gonna go ahead and request that ALS. This ain't looking too good.
Okay. Is there
I'm gonna go
anything
up
else
to
you
him.
want to try to request with ALS?
Ooh, that's a good point. A chopper.
Yeah, that's a good idea.
Yep, go ahead and get that chopper rolling.
It's a chap.
Because I learned today it takes like 10 minutes for that thing to even warm up, right?
7 to 10 minutes, yeah.
Yeah, that's
7 if
fucking
they're moving.
ridiculous. That's crazy. Anyway, alright, I'm gonna go. Hey, sir, can you hear me?
No response.
No response. Alright, I'm gonna go ahead and check that pulse.
Pulse is weak and thready.
Pulse is weak and ready. Alright, I'm gonna go ahead and do a gross blood sweep.
Okay. You have blood around his ears. You have blood underneath him. You have blood that you can see in his shirt. And you have blood on both legs.
Okay, I'm gonna go ahead and cut off all of this clothes. Do I note any bright red?
You see bright red spurting blood coming from the left leg.
Alright, I'm gonna
You
go ahead.
also have bright red spurting blood coming from the right arm. I've kind of
Oh.
deviated a little bit from what I actually had, but we're getting there.
That's fine. Alright, those need to be tourniqueted. The other dark reds can fuck off.
Can they?
For now, yes. Um, tourniquet those up. We good to go. They stop.
Okay.
Alright, I'm gonna check that breathing.
Yeah. Alright, you have gurgling respirations.
Ooh, that's not the sound you want, buddy.
No, it's not.
Alright, hold on, this is a decision that I'm not sure what to do. I understand that I need to suction this, but
Okay.
do I roll him over because he's probably got a fucked neck? So
In
Do I
this
leave him?
particular instance, it would be you'd have a partner. So if you want to log roll and secure C-spine, you have the capability to do so.
yeah,
This
okay.
person is kind of crumpled up, so imagine somebody lying on their side with their right arm curled up and their right knee pulled in also, and their left leg sticking straight out and their left arm sticking out in front of them, and his head's laying against the pavement.
Which side is he laying on?
He's laying on his right side.
So he's laying on the curled up part?
Yep.
Okay. I mean, honestly, that's a good enough position to fucking make sure he's not choking. So, just manage that C-spine. Gonna jaw thrust that puppy open. Suction out the gurgling noises.
Are you gonna get him on his back? Or are you gonna leave him the way he is, curled up?
No,
The possibly
no.
compromised C-spine.
No, like back supine after get done suctioning.
Okay, that sounds good.
All right. So what is his...
you've moved him supine, excuse me?
Yes.
Okay, so you've moved him supine. You've moved him, what do you want to do?
So what's his respiration rate?
Respiration is 8.
8. All right, I'm gonna go ahead and throw a monitor. Tell my partner to throw a monitor on him.
That's a good idea.
Yeah, get his vitals. His O2 stat.
O2 sat is 74.
74. All right. BVM with oxygen. Oh wait. Do I notice his breathing sounding any different now after suctioning?
Yeah, it's cleared after suctioning.
Okay. Gonna insert an OPA.
Okay.
And
He accepts it.
okay, BVM with oxygen at 15. I'm gonna fucking load and go this. Or wait, no, we called the chopper. We're waiting on chopper.
You're waiting on ambulance.
Yep. I guess. What's his O2 now that BVM and.
O2's at 86 now. And climbing.
Okay, just we're trending the right way. We're just gonna keep doing that. Kind of just fucking.
Do you want a heart rate? Do you want a blood pressure? Slow down and
Yeah.
think.
Yeah, need all the vitals. So, what is the heart rate?
Heart rate is 120.
All right, and his blood pressure.
Blood pressure is 86 over 48.
So his pulse, is it? No, it's still gonna be weak and thready.
Yep.
Uh,
So at this particular moment, what is your patient in?
what do you mean?
What's going on with your patient? He's got a large amount of blood on the ground.
Oh, like what kind of shock?
What's going on with him? Which it would be shock. That's
It's
that's accurate.
hypovolemic shock.
It's hypovolemic shock caused by trauma.
Right. Oh, cover him up with a blanket.
You do need to do that. Treat for shock.
I don't think we've done treat for shock yet.
That's how you treat for shock. So you want to kind of try to keep him warm and oxygenated. So you want to fog oxygen to him, and
What is fog oxygen?
I mean, like you want to give him a lot. Like you want to hit him
Okay.
with it. So non-rebreather
no-
15 or
Yep.
BVM 15, depending on their status, and put a blanket on them.
Yeah, I am
Make sure their
smoking this
bleeds
guy with
are-
oxygen right
Make
now.
sure their bleeds are good. So, do you want to check anything while you're suctioning, or do anything with his head? Decap BTLS.
Actually, before the yeah. We haven't made it to trauma yet, so I'm kind of winging it.
Okay. I'll help you out a little bit. Okay, so let's rewind.
Hold on, just a second.
Let me rewind a little bit because it's kind of big.
Yeah,
So
I think I know what I missed though.
no, what I'm saying is I'm about to toss in some extra stuff because if y'all hadn't really gone over trauma. So with the gross blood sweep, immediately after you usually want to do your decap BTLS. So when you would have done that, you would have noticed that his skull is, you have crepitus in his skull. His left eye is trying to pop out. And the only thing keeping it from popping out is maintaining pressure on the left side of his skull. There's blood all over his face. You have crepitus all on the right side of the patient, specifically to the torso, so the ribs. You have an exposed humeral fracture. You have an exposed femoral fracture, both on the right side.
Okay.
So do you know what decap BTLS means?
I think we've said that, but I don't remember it. I think we've looked
Okay,
at
so
it.
decap BTLS, deformities, contusions, abrasions, punctures, tenderness, lacerations, decap BTLS. The S always got me. Sucking chest wounds, I think is what it was.
Okay. But I remember what I missed.
Okay, go ahead.
Remember those wounds that I was like, fuck that, we'll get back to those.
Yeah.
We're gonna go ahead and patch those up and all this other stuff that you said that I don't really exactly know how to treat.
Okay. So the oozing is going to be part of your secondary assessment. You'll assess those later because they're not life threats. You're right to go ahead and hit the life threats. Like as soon as you see those bright red spurting blood, you need to treat that, but you also need to pay attention to his airway. However, if there's no blood, there's no point in having an airway because that's the whole reason. So you fix the bleeding,
Right.
you went to the airway, that's good. Cleared the airways, breathing good, and you put an OPA, you gave him a BVM with oxygen, you got him breathing, you got him breathing, you're breathing for him. And you want to assess everything that's going on. So while you're putting in an OPA, what do I see before I put that OPA in? What's wrong with it? Is there anything going on with his face? Is there anything broken up that I see while I'm doing this? And once you get done treating those areas and you're assessing those areas as you're treating them, as you log roll your patient, you assess front, back, side as you're rolling. And you see what is the life threat while you're going through it. Now, shit. Okay, so after all of that and you've treated what you saw, you say, okay, I'm going to go ahead and check the other areas, DCAP, BTLS, that I didn't treat immediately and make sure there's no other serious life injuries that I may have missed. And you'd be like, no, okay, you're clear. All right, good. Then you continue doing what you're supposed to do. So you put a blanket on them, that's right, you're supposed to do that. Whether or not if you have a blanket is another story, but that's IRL, not test taking world, where everything's
Right.
perfect and you have everything all the time. You called for a helicopter, that's good. The ambulance is coming, they should be almost there by now. At that point, the ambulance would arrive on scene, typically. Patient care would transfer the ambulance. However, you're still going to assist. So you would assist with patient loading. The best point for moving that patient, which is a good thing while you had them in supine position, stabilize their C-spine also. They can take, also with the fractures, depending on what you have as far as equipment, you can kind of stabilize those a little bit. Now, an open femoral fracture is kind of not easy to do, and nor is an open femur fracture with what we have on the trucks. However, I believe they let y'all say if you have a traction splint or something like that, like if it's a bulging fracture, that'd be compartmentalized, not an open fracture, typically. So you should be fine with just kind of splint in place, kind of keep it from moving best you can to prevent further injuries. So the ambulance shows up. The best thing that you can use to move them is a scoop stretcher. They may
Yeah, 'cause
want
their
you
hips
for
are probably all fucked.
hips are probably all fucked, but also everything else. And if you log roll them again, or you put them on a spine board, you have an increased risk of jeopardizing C-spine even more. So, excuse me. You'd assist them onto the ambulance, help the ambulance with anything else that they need done, keeping the patient warm, spiking a bag for them, whatever you need to do for fluids, because they're going to need fluid. Assist with the LZ, assist patient loading into the helicopter, and GTFO. So helicopter needs about 100 foot by 100 foot minimum landing. So that's clear 100 feet up, clear 100 feet out, and a little square around,
Would
which would be the landing zone.
would you have to find this area for them?
We have pre-designated spots. So
Okay.
Pila. So I think it's like pre-examinated or predetermined landing area.
Okay, and then you would transport via ambulance.
To the helicopter, to the landing site,
Gotcha.
yeah.
Okay.
Because at that point, that would be their best care option.
How'd I do
And
for
with
not having trauma?
Well, not bad. We just gotta, just slowing down and looking at everything. So since you can't physically look at it, you're like, okay, we'll ask a question. Just ask. You'd be like, hey, it's this dude got, a dildo in his ass? What's going on? That sounds kind of wild, but you'd be surprised the shit you get. But, just ask questions, ask a bunch of questions.
Shit. That was a one. I dig trauma. That's the one I'm ready for.
Yeah, traumas, I like traumas.
I think that'll be my favorite chapter.
Yeah. What the
So what do you
heck?
think? What that one was passable. I got the main stuff done.
Yeah, for the most part. Yeah, I would say so. But still working on it though.
Yeah, I only messed up by putting the blanket on them before going back, but that's what I was gonna do next whenever I realized